Alright, ladies and gentlemen, I told you I'd look up actuarial value. This is healthcare bill part number 47. Actuarial value is an average value of how much the health insurance will pay and then how much you will pay. Okay, now let me give you an idea like this. Let's say you're on an 80-20 plan. You've met your deductible and now you're on 80-20. They're going to pay 80%, you're going to pay 20%. Now, on most everything that you're covered under, they're going to pay 80 and you're going to pay 20. But there are some specific things that they won't pay as much as 80%. Okay, like there may be certain surgeries that they won't pay 80% of, or there may be certain types of treatments that they won't pay 80% of. They may pay like 65 or 70, or even lower than that. Who knows? But most of the things that you are covered under with this 80-20 plan, they'll pay 80%, you'll pay 20% until you reach a certain amount, and then they kick in a whole 100%. Okay. Now, you've been hearing about the bronze, the silver, the gold, and the platinum coverages. What are they? Okay. If you have a 60-40 plan, where they pay 60% of your bill and you pay 40%, that's a bronze coverage. If they pay 70% and you pay 30%, that's a silver coverage. If you are on an 80-20 plan, you have gold coverage, and if you're on a 90-10 plan, you have platinum coverage. Platinum coverage, of course, is very expensive. Okay, most employers will provide you with an 80-20 plan. Whereas with other companies, if you were to try to buy your health insurance all by yourself, you may get a 60-40, a 70-30, something like that. Okay, so again, if you're going to deal with a bronze plan, that's going to be 60-40. A silver plan is 70-30. A gold plan is 80-20, and of course a platinum plan is 90-10. Okay. So an actuarial value is an average of what they'll actually pay on a particular doctor's bill. Okay. So if they're telling you it's going to be an 80-20, what that means is as the doctor bills come in, most of the time your health insurance will pay 80%, and then you'll have to kick in the other 20. However, there may be some special treatments that they won't pay as much as 80% on. So watch it when you're trying to get treatments for medical illnesses. Okay? Coordination with preventive limits. Nothing in this paragraph should be construed to allow a plan to have a deductible under the plan applied to benefits described in Section 2713 of the Public Health Services Act. Okay, that would be when you're talking about preventive services, like blood work, or if they're checking your weight or something like that, that's just automatically paid for. There's no deductible on that. Okay. Cost sharing. In this title, in general, the term cost sharing includes deductibles, co-insurance, co-payments, or similar charges, and any other expenditure required of an insured individual with a qualified medical expense within the meaning of Section 223D2 of the Internal Revenue Code of 1986 with respect to the essential health benefits covered under the plan. You can look up Section 223D2 if you want to and see what that actually means. And if I'm in a really good mood, I might look that up for you at a later time. Exceptions. Such terms does not include premiums, balanced billing amounts for non-network providers. Now, when you talk about premiums, these are the premiums you pay in order to be insured in the first place. Balanced billing amounts for non-network providers. That is the bills you receive from doctors who are outside of your health insurance network. Okay. And if we're talking about spending for non-covered services, some health services are not covered under your health care plan, and so therefore that's what they were talking about. Premium adjustment percentage. For purposes of this paragraph, the premium adjustment percentage for any calendar year is the percentage by which the average per capita premium for health insurance coverage in the United States for the preceding calendar year, as estimated by the Secretary no later than October 1st of such preceding calendar year, exceeds such average per capita premium for 2013 as determined by the Secretary. Okay. So this part here is talking about how they're going to adjust your premium year after year. Okay, and the premium is what you actually pay to get coverage in the first place. Alright. Now they're going to talk about level of coverage. Alright. And as I told you, we already talked about the bronze level, the silver level, the gold level, and the platinum level. Now they're going to completely define for you the actuarial value. In general, under regulations issued by the Secretary, the level of coverage of a plan shall be determined on the basis that the essential health benefits described shall be provided to a standard population, and without regard to the population the plan may actually provide benefits to. So, the essential things that you have to have: coverage for heart surgeries, coverage for pancreatic surgeries, the basic stuff, coverage for emergency room visits, that kind of thing. That's what they're talking about in essentials. These things you absolutely have to have. There are some coverages you don't have to have, and then there's some coverages you do. When you go to the ER, you have to be covered. It's that simple. So, and you have to have coverage for ambulance services. That's just essential. Okay. So, when you're talking about an emergency room visit or an ambulance service, you're talking about they will actually pay 80-20 on something like that. Okay, or 70-30 or 60-40 according to your plan. The Secretary may issue regulations under which the employer contributions to a health savings account may be taken into... Well, this is... the meaning of this section is from Section 223 of the Internal Revenue Code of 1986, and you can look this up for yourself. May be taken into account in determining the levels of coverage for a plan of the employer. Okay. Application determining under this title the Public Health Services Act or the Internal Revenue Code of 1986 the percentage of the total allowed costs. The percentage of the total allowed costs. Let's keep going up. Of benefits provided under a group health plan or health insurance coverage that are provided by such plan or coverage, the rules contained in the regulations under this paragraph shall apply. Yeah, try to interpret all that. Allowable variance. The Secretary shall develop guidelines to provide for a de minimis variation and the actuarial valuations used to determine the level of coverage of a plan to account for differences in actuarial estimates. Okay, I guess I better look up de minimis and tell you about that in my next video. So at this point, I'll just tell you to stay tuned, and I'll tell you about that in the next video.